Well, good afternoon, welcome, and thank you for joining us. My name is John Copps, and I'll be chairing today's conversation. This webinar is part of Mutual Ventures Place Leadership work, so if you're interested in that, do have a look on our website. I'm very much looking forward to this discussion, which addresses a topic that's right at the core of our public services and what it means to serve the public in a local area. So you might ask, what are we doing running a session on a policy from 2009? Well, at the end of January, the then Shadow Devolution and Local Government Minister, Jim McMahon, suggested a return of total place, this policy, should the Labour Party win the election. He's now Local Government Minister, so we can read into that what we might. So total place was born of circumstances following the 2008 financial crisis, its impact on government finances and the need for cost savings. But it was also radical in imagining a holistic view of local services and challenging that culture of individual organisational targets. Today in this webinar, we're going to unpack total place. We're going to examine its strengths, its weaknesses, and the lessons that were learned. And we're really lucky to be joined by two people at the centre of two of the local programmes. They'll be racking their brains back to 2009, but also reflecting on the legacy of the programme and asking, is now the right time again? Before that, we're going to start with a quick overview or reminder for those who were around back then of what Total Place was and how it came about. So welcome to my Mutual Ventures colleague, Liz Rowe, who's been looking at that. Hi, Liz.
Hi, everyone.
Can you tell us about Total Place?
Yeah, so Total Place was a policy introduced by the Labour government in 2009 following the banking crisis in 2008. And the goal was to have better for less, so to deliver better public services at lower costs by improving multi-agency collaboration and by having an enhanced focus on preventative public services. So the program consisted of 13 pilot areas, and each was led by local politicians and senior managers. And each one had a specific theme that was tailored to their own area's specific needs. So, for example, Durham focused on housing and regeneration, Gateshead, Sunderland, and South Tyneside focused on drug and alcohol misuse, and Croydon focused on improving outcomes for young children. I see the screen is potentially sharing now. This just shows the map of the different places involved in the pilots. So in terms of the design of the Total Place pilot, it was built on 3 complementary and interlinked strands: counting, culture, and citizen insights. So the counting strand was about conducting deep dives to assess local and national public service investment. So figuring out how money was being spent, whether that money spent is being used effectively, and how resource allocation could be changed in order to achieve better results. The second was the culture strand, which was trying to figure out what barriers are actually preventing cross-system collaboration and how can we sort of chip away at those barriers. And then thirdly was the citizen insight strands. This was about engaging with local communities and engaging with the people in the place to figure out what their priorities are, what their needs are for public services, and how public services were currently working or not working for them. Total Place ended then amidst the change of government in 2010.
So why is it the time to revisit now?
Yeah, so I think there are kind of 3 main reasons why now could be a good time to revisit Total Place or something like it. So first of all, as I said, Total Place was originally introduced following the 2008 banking crash. Today, public services are under even tighter budget constraints than they were 15 years ago. So you can kind of see how it might be attractive to have a policy that aims to deliver better public services for less by improving cross-system collaboration. Secondly, the population needs are becoming more complex and more chronic. For example, we have an aging population. And so problems are sort of becoming more interdisciplinary, and it follows then that the solution should be more interdisciplinary as well. If agencies across the system can kind of share that load, it might be more resource efficient, organized, and effective. And then finally, place leadership, which is the concept of everyone just getting together in the same room, removing silos between partners, is an increasingly popular idea. We're seeing increased interest in police-based local collaboration and more movement towards devolution towards local areas. So all of this sort of suggests that something like Total Place could come back in the near future.
And we're 15 years on now from 2009. So what are the barriers now that would need to be overcome for it to be successful, do you think?
Yeah, so in my mind, there are three things related to this as well that we'd have to really pay attention to. The first is that because budgets are more strained now, there might be less appetite to invest in preventative services, which might not be able to reap visible benefits for years to come. When you have really tight budgets, it's hard not to prioritize like acute crisis management. Secondly, investment may be disincentivized because the organizations that make the investments might not actually be the ones that directly accrue the long-term savings from it. So, for example, during Total Place, Birmingham estimated that every £1 of city council investments in early intervention for children would translate to £10 saved for the city. But because only a quarter of that saving would actually go to the council itself, you can see why it might not be that attractive for the council to want to invest that money. So for Total Place to work, that would need to be overcome either by finding other means of incentivizing investments or by creating a culture where the whole system is really truly seen as one team. And then finally, I think the other thing that I'm wondering about is it's all well and good to say, cross-system collaboration should happen. That would be good. But I have kind of questions about how that can actually practically be facilitated. How do you make it work? How do you make it stick? And I don't have a great sense of how it was done or how well it worked in Total Place 1.0. So it'd be really great to hear some insight from our guests about that in this session.
Brilliant. Thank you, Liz. That was a really helpful summary. So before we meet the panelists, an invitation to you, the audience, to ask any questions you have, and there's a Q&A facility on the webinar. So please do pop questions in there and we'll get to them if we can. So delighted to say we've got two panelists to talk to you from different parts of the country involved in Total Place, and I'll let them introduce themselves. Nuala.
Good afternoon, everyone. I'm Nuala O'Rourke, and I was the programme lead for the Total Place for Greater Manchester and Warrington, and we were focused on early years.
Welcome, Nuala. Fenella?
Yes, good afternoon, everyone. I'm Fenella Beckman, and I was the program lead for Total Place pilots in Lewisham, London Borough of Lewisham. We actually had 4 Total Place pilots. So there was worklessness, there was a worklessness one. There was one on reducing reoffending. There was one on health and social care, and there was one on assets and energy, and so kind of coordinated all of those. But I also worked and managed the worklessness one, so that's the one I was most intimate with. But the LSP had the 4.
Yeah, that's brilliant. Well, you'll both be racking your brains. So it was a long time ago, but wonderful to have you here, because I think this is an important discussion with what might follow for local government and local services. So to kick off, I want to ask you, so Nuala, tell us a bit more about the Total Place pilot in Greater Manchester and Warrington, what the theme was and how you went about it.
We set, as you heard, there were the streams of place, counting and customer insight. So we had a wide range of different projects which led in, and counting was probably the most difficult one, because Greater Manchester and Warrington's huge, and it was a lot of counting, let's put it that way. But we were focusing on early years and the importance of early intervention and what the potential cost savings were on statutory social care, really, and police, statutory social care, ill health and police intervention. So those were the things that we were looking at, and we did a whole range of early years pilots across the 11 council locations that we did, all looking at maybe slightly different things. And we did a big customer insight work. And I have to say that was one of the very interesting pieces, the customer insight, because it was my first job in the public sector, and it taught me so much that I sort of knew in my head from the previous work I've been doing, but about how people experience what it feels like it's being done to them. You know, what their customer journey looked like, and it did lead on to work like the famous Salford family, where the chief constable said it would be cheaper for me to put us policemen on the sofa full time than deal with the amount of chaos this family causes in the community. So that sort of led on to that. We were very looking at the time. So, you know, it was much more, I mean, there's been many things, and later on I'll talk a bit about the legacy, but we were very much looking at maths, which I think was a bit naive. You know, we were saying if we did A and B, we'd get C, and that would save us £10 million. And that was, it was a little bit naive, because it's never as simple as that, because humans aren't roads, they're not tarmac, and you don't get a cheaper deal with humans if you buy in bulk, if you see what I mean. And I think one particular part that I still remember is that we talked about incredible years and the outcomes of incredible years, doing cost benefit analysis and trying to triangulate that with less children in care. And it came up with phenomenal figures, even with the bias taken into account, but they were just unrealistic. And I think the biggest thing was that we learned, some of the biggest things we learned over the time was that you can't get the cash out of the system. You can decrease demand, you'll meet unmet demand then, but actually cashing something out is really, really difficult. And the complications of, and I've talked a lot about political with a small p and political with a big P. So the politics of politicians who are living on a 5-year maximum time span in terms of their aims and ambitions, and the politics internally of the police say, well, you know, we've only got a small budget and we've got 10 boroughs, you know, and then, you know, the local authority saying, well, we've got an even smaller budget, and so on. Those are difficult to navigate. Possibly the harder one was the political with a big P, because early intervention anywhere is probably a 20 to 25 year payoff. It's not a 5-year payoff. And then the other area that caused some issues was around government departments giving up something. You know, I mean, I would say I was at the heart of devolution of health in Greater Manchester, but from where it started as a proposal, it became just a Greater Manchester NHS without it being devolved into the Greater Manchester Combined Authority.
Okay, well, let's pick up some of those when so you sort of, the point about cashing or whether or not you can cash savings, the politics and the control point. But before we do that, let's hear from Fenella on what happened in Lewisham and how. So give us a bit of a sense of the story in Lewisham back then, and what you were trying to do and who was involved.
Okay, so in Lewisham, our projects were run under the umbrella of the Lewisham Strategic Partnership, and I don't know if colleagues on the call webinar will know, but Lewisham was one of the first 4 places in the country at the time to have a directly elected mayor, and so you know they were literally new in, and of course you had the LSP. Our LSP was chaired by the directly elected mayor. So the relationship between the Lewisham, the public agencies, volunteer and community agencies in Lewisham was really quite mature, but having a directly elected mayor added a certain something to the pot that made Total Place work very, very, very well in Lewisham, because we already had that long-standing relationships between certainly the public sector partners and the voluntary agencies, which had been going, you know, for previous, because we'd set the LSP up in 2000, and you know, by then, you know, we'd kind of done almost, I think, 2 elections, with the mayor, and so things were going quite well. So in terms of the Total Place pilots, we picked up on the kind of what you call the wicked problems back in those days, and for us it was worklessness. I mean, you got to remember at that time you were entering a period of relatively low unemployment, but we still had this hardcore people that just, government policies, over the years had just not made a dent on them. We'd gone through growth and everything else, but you just couldn't move this frost of people that were just that was workless, that were workless. And so we sought to, so that's on that particular pilot. So we basically tried to work out and understand and calculate the overall costs to partners on the support provided to out of work citizens, because we thought we're putting all this money in, but we're not really seeing the shift, the outcome. We also wanted to understand the configuration of services and how this was felt by the customers as well as by ourselves. And we also, one of the things that came out of it, we showed how customers experienced our fragmented services. This is the worklessness I'm focusing on.
And who were the partners, Fenella? So
Right.
just fill that in a bit for us.
So the organizations involved at the time were obviously the council. You had Job DWP, I don't know, and obviously Job Centre Plus, which was the actual body that people met. You had the Learning Skills Councils were involved. Organizations called like the LDA at the time.
Mm-hmm.
You had colleagues who were delivering the Working Neighbourhood Funds. You had community and voluntary organizations that received funding either from the council or from DWP or from Job Centre Plus to deliver employment programs. You had a further education college, Lewisham College, and all of those were the kind of partners. But what we found out was that all these organizations created a maze of provision that citizens basically struggled to navigate. And there was lots of duplication. DWP were funding projects left, right, and center because their aim was to show Job Centre Plus and to show how they were spending public money on all these programs. But all they did was they were just funding, 8, 9, 10 community organizations to do CV refresher courses and this and that. There was a lot of duplication, because what we weren't doing was spending money thinking about the outcome for residents. We were thinking about public agencies on KPIs, how much money can you do on this, how much you're funding that. So that was the kind of the problem. Do you want me to talk a little bit about the work at this point or later, the work that we did?
Well, you can say a little bit, yeah.
Yes, okay, so right,
so
the work that we did was kind of in 3 parts. We had a kind of customer insight work where we interviewed 50 service users.
Mm-hmm.
And you'd expect we were randomly selected, but obviously matching certain archetypes. We also then had in-depth ethnographic work with some of the service users. You had the 50, and then we had a slice of those that we did ethnographic work with, and where the ethnographers spent about 2 days kind of really living the lives and walking in the shoes of our service users and looking at kind of their touch points, experiencing. So we've got, the material that came out of it is, we watch them go to different places and all being asked the same information, and all having to fill forms for this, which was exactly the same stuff, stuff like that. And then the third thing that we did was we had videos of about 5 or 6 of our users, where again we went even deeper with with a customer journey mapping and all of that, and you could just see the confusion that was out there, and not at any point had we really sort of worked out, what does this person want to do, what can they do. It was all about what we wanted them to do, and so on. So that was just kind of in general around the worklessness. With the reoffending one, it was ethnographic work, and some very close kind of journey mapping with people. And I think with that one, I wasn't as closely involved in it, but I do remember that with the main kind of learning from that was, you had things like, in those days, people were released from prison with kind of 2 weeks worth of money, but it took them 8 weeks to get their benefits sorted. So, what do people do for 6 weeks? Ooh, let me think. No wonder they were reoffending. Or they would do things like release people from the north of England, because that's, and they had to find their way back to London on a Friday afternoon. And they had to find their way back to London for the weekend, turn up in London. Of course, all the public offices are closed, and then they'd have to wait till Monday before anyone could see them. So that was the kind of thing that we learned, that
Yeah.
join up wasn't there. Yeah.
So I guess that all the pilots were focused on this fractured journey, this
Yes.
this
Yeah.
silo mentality.
Yeah.
So Nuala, is that familiar in the early years work you did in Great Manchester?
Absolutely, and in work that followed on from that, particularly what we call the Friday at 5 problem.
Yeah. Yes.
A crisis would happen to a family at 5 o'clock on a Friday,
Mm.
and there was just no one there to help. And the habit, particularly of the local women's prison, of releasing women on a Friday afternoon,
Yes.
prison,
Mm.
at the point when services are pretty much shut down.
Yes.
Just a total lack of understanding. And in adults' work,
Mm.
still happens, releasing really older people from hospital at midnight.
Mm.
And expecting them to be able to manage in the middle of the night. But
So can you say a bit, Nuala, can you say a bit about how partners joined up? Like, what was the mechanism to do that, to make sure that actually?
So the first part was, when we said in Greater Manchester we wanted to do this, that was then what had to happen. Then was we had to bring senior leaders together in person to talk it through and make a commitment, almost like sign the deal, as it were, to be open and honest, to work together. And we did quite a lot of relationship work, building relationships in the room, making sure that there was real connection between senior leaders, because they are the people who need to say yes for anything to happen. So that was it, and it was the whole public sector that came together. So we are talking education, we are talking police, we are talking fire, we are talking probation, hospitals, mental health trusts, local authorities, housing trusts, and some of the bigger local charities joined in as well, just to look at because one of the big pushes in our heads was building a different relationship with our communities, serving people in the place, and reducing the dependence on the public sector, and that's still there today, isn't it? We are all seeking to reduce dependence and encourage communities to support themselves, so that the first layer of support comes from within the community where people live, rather than them always seeking a service response that isn't always either available or appropriate. So it was also then building relationships with our communities where we were running pilots. So we needed to build those relationships in the community, to involve the community. And I suppose one of the things we learned, and we learned it again and again, was that people in deprived communities are absolutely sick of pilots. Because we go in there, we do something, we leave no legacy, and when the money runs out, we walk away. And there's no legacy. So that was the other thing for us. What's the legacy of what we're doing here? If we walk away with no legacy, we failed, because we knew the pilots were time, they had an end time. So there had to be something we were going to do afterwards, or that was going to be left for the community afterwards. So those were the really important things.
And let's go back to the legacy in a bit. So can I? So the part of the point of Total Place was to think about a place and not to think of silos. So what was it like, perhaps Fenella, when you got everybody in the room? Did it feel different? Did it, all the senior? Did it feel like there's a concept around the place pound that they talked about, that i.e. all the services should be one service and think together? Did that come to pass, or was that more sort of rhetoric than actual reality?
Well, I mean, again, I'll take you back, John, to where I started. In that Lewisham, we were very, very far down the road already because we had a very strong LSP, a very clear leader who the whole of the public sector were recognized. We also, at that time, very unusually had, in our public services, we had, chief executive of the hospital, chief exec of the Lewisham of the college, the police. For some reason, they'd all been around for 8, 9 years or longer in the case of the Lewisham chief executive. So their relationships were already pretty solid. So when we set up Total Place, you were kind of talking to people who the concepts were new, particularly around the releasing of the budgets. That there was some newer stuff there, but you already had a trust and a way of working. We already had a kind of, I think we used to call it you had the LSP, but you also had a public services board. So we already had those mechanisms in place and they've been going, 10 years since the LSP was set up, having a club. So it was the natural place for these conversations to take place. We were trialing things like apprenticeships across the public sector. We were already doing some things like that. So it was kind of not so difficult. It wasn't rhetoric. And we did progress a lot because some of those barriers did not really exist. So I think Lewisham was one of the most successful places. And, we'll come on to talk about this later, but we did carry on Total Place after it ended. We didn't necessarily manage to bend all the budgets into like kind of one pot, which was where we all dreamed it would be. But we did achieve a lot of steps along the way where we did have we did work across boundaries. Yeah.
So Nuala, that concept of the place pound, so pooling budgets, did that ever happen in Greater Manchester and Warrington?
No,
How far did you get?
Like Lewisham, Greater Manchester particularly has a strong history of working together. And before the Greater Manchester Combined Authority, we had AGMA, the Association of Greater Manchester Authorities, and before that we obviously had the Greater Manchester Council. So the partnership of the 10 areas and the public services in there was very strong in voice. It was said. But I think that the concept of two things, one of a budget pot and the other of cashable efficiencies, are the things that we were going for, but they were the wrong things to go for because they're not achievable. There's just too much. You can get somewhere with it, but I think the important thing for us that we learned was it's more about sharing resources. Doesn't matter who pays them, it doesn't matter what budget it comes out of, but if those people work together in an integrated, not co-located, but integrated way, and that was our pilots were about integration in remember children's centres, those things that we don't have anymore, but integration in children's centres. And we learn, I mean, one of the things I have mentioned previously when talking about Total Place is going to a children's centre to see the integration in action fairly early on in the pilots, only to find the milk labelled midwife's milk, because that's not integration, that's co-location. And so we learnt the importance of the right words and not assuming co-location means integration and not assuming listening means hearing, because it's a very different thing. So for me, the success of Total Place was about the lessons we learned about customer journeys, how people feel, the fact that if we work together, we will remove duplication without a doubt. What we won't do is say, great, we can have 2 less social workers and 4 less police officers, and that's because the biggest cost to us is staff, isn't it? And what happens is that, so you reduce the amount of demand on A&E because you're not taking people into A&E on a Friday night sitting with them for 12 hours because they're having a drug or alcohol crisis. So you're not doing that. All that means is waiting times get a bit shorter. It doesn't mean we can get rid of, a couple of nurses and a doctor. So, but by sharing the resources and working together to say, to say, what's the most efficient way of doing this, and what does it feel like for the person in the place, and how can the place become more resilient? Those were the things that did come out of it. But cash flow efficiencies, shared budgets, as in notionally shared budgets, as in how do we spend this money together, but no actual, oh look, let's create one big account and pop all the money in there. That didn't happen.
Yeah, no, absolutely, John, echo that. So yeah, I was just about to add, like Nuala said, and I was saying earlier on, we had it at the strategic level and, kind of all the way down to a point. But actually, when it came down to it, for operational staff, it didn't really kind of sit in, because operational staff have JDs and jobs to deliver, which work in a particular way. And so, where we were successful in the further pilots, that the work that we did that took Total Place on, was when we started doing things like creating the family-based teams, whereby the people from the different agencies all had like the same job description or similar. We kind of suspended their organizational asks, and they were kind of seconded into this team. So they brought in their skills and everything else and their access to their different IT systems. So we didn't have the data sharing could work a lot better, but we couldn't get people to work in a totally integrated way. As Nuala said, it was more of a co-location rather than integration because of what she set out.
So on the if actual physical one account sharing budgets is kind of too difficult, really, you talked about pooling resources instead of pooling budgets then, but equally in your first answer you referred to the difficulties of passing over control from one organization to the other. So how did that play out? How did you resolve that?
Because that played out much better than you would think, because the aim was to have a shared vision, and I describe the public sector as and public sector reform as a jigsaw. And you're going at different paces, but as long as you're all looking at the same picture on the front of the box, doing your bit of the jigsaw, one day will never get finished, but it will get more and more comprehensive as you go along. And so, people buy into the overarching vision that you have for the area and for the way public sector works with the place and how the community sees and experiences the public sector, then you would you got the cooperation to say, well, let's give this a go. And it was a different time, and there was, surprisingly a lot more money then. We thought we were broke then. We didn't know what broke was.
Yeah.
but the willingness to say, okay, yeah, you can have a housing officer in the children's centre. Yeah, we'll put a police PCSO not in uniform in the children's centre with you. So going on, because we didn't stop in Greater Manchester when Total Play stopped. We carried on, and there's a whole range of things that we're trying to do the same thing that came afterwards. So we didn't stop. We carried on working on it, and that at that time, people were willing to say, well, we can give up a few workers to test this out and see how it works, and we will see. We will give up management of those workers, and we will give up task management of those workers, because that's really important to understand the difference between managing a person and managing tasks. Because you can still manage the person if you want to, but you're not tasking them on a daily basis. That's being done from the person who's leading the pilot.
Yeah, so sort of very similar as well with us. What we did was we had a shared vision, which, the LSP vision, the partner vision. So everybody understood that. We very, very quickly worked out that the NHS were not going to put all their money in with the council. Neither were we. So we very quickly worked that out. But what we also did was we said, actually, what we're very interested in, our chief executive at that time was a gentleman called Barry Quirk. And he was sort of very well known nationally at the time as well for all his other work around, public assets and money and all of this. And he very quickly worked out that what we needed to do was look at outcomes for the citizens. And so we stopped worrying about putting all our money together and started thinking about what could we agree on what the outcome on this for the individual, the citizen was, and then do what we could do and tailor what we could tailor from our budgets to achieve that outcome in the most efficient way. So we did, and that's basically what we did. So we worked using our powers and the money that we had and what we could allocate to a shared vision rather than lumping in all our money. Because actually, in the end, all the partners involved did achieve something out of that. So, for example, we found out, and this is, as I say, going back 14 years, at that time, it used to be called incapacity benefit. I think it's now called PIP, right? And we found out that costed more than job seekers allowance at the time, but most public funded support targeted job seeker claimants. So we also, and at the time, we also found out that little support was aimed at lone parents, even though in Lewisham we had a very high lone parent population that was workless. So if you wanted to kind of shift worklessness, everything that was publicly funded and all our programs was literally aimed at this sort of 30%, and yet the 70% was just not being touched. And it was that work is what then did that. It enabled us to start thinking, right, we're not really targeting our money where the problem is.
I guess that in a nutshell, the silo problem that we think that Total Place was trying to overcome, the separation of organizations, is the one where an organization could do something. Let's say in the case of children's social care, let's say a council and a police force. But the police force often gets lots of call outs to a family, let's say, and what they kind of, in their interest, it's probably for the child to go into care so they don't get more call outs. But actually the best thing for the family is for them to keep coming out if they need to over time, so that the child can stay with their family, and it can gradually be that can be a long-term outcome if it's possible. But how do you get an organization to do something that doesn't directly benefit it? That's the question, isn't it? How do you get the police force to keep coming out when, to want to keep coming out because they realize it's in the best interest of the child?
Well, that's the shared vision, isn't it? I mean, our shared vision is that people will, be happy and healthy, economically productive, living the best lives that they can. And to do that, you've got to think about what's right for the individual at all times. However, you also have to look at what I call, the police are often involved in non-value work. They contain rather than improve. That's what they do. And the legacy of that is the latest change in policing, which is saying, actually, we don't do safeguarding anymore. We're here about crime. And, we're not going to do safeguarding. That's over to you lot. But that was one of the biggest things when we started doing pilots, was the amount of non-value work that went on. The amount of passing people, the saying no at the doorway, the gateway keeping that cost more money because people came back over and over again. And the legacy of that has been that we now pretty much all children's services, particularly in Greater Manchester, do something with every call. There's never a no. It might be information, advice and guidance. It might be pathway to other organisations, but there's never a plain no, because the no just means they'll come back. So that was a fascinating piece of learning about how much energy we put in to non-value calls, and the police are particularly affected by that, and therefore recognising that for them and recognising we need to seek alternative solutions together so that their time is being valuable rather than just containing situations is a good way to build partnerships, because you're saying to them, yeah, we see your problem here. It's a shared problem, because we'd much rather you were out there keeping the streets safe than sitting in A&E for 24 hours with somebody who said they're going to kill themselves. So what's our shared solution to this? How do we work it through?
That's really interesting. Can we move on to a bit about the legacy then of Total Place. And in Lewisham, Fenella, in 2009, 2010, how did Total Place end?
I actually I was trying to remember this. I actually don't recall how it ended. I know there was a couple of reports that we submitted because I found this in the archives. We had to, this was all done as part of the kind of overarching kind of government program. So there was the customer-led it was part of the local government delivery council, which was obviously supported by, whatever version of MHCLG was at the time. So so we did submit the kind of reports for all 4 pilots. So that, I suppose, was the kind of formal ending. And the idea was that it was going to go into policy making, or they were going to be used in and evaluated into whatever would have come. And then, of course, it never happened because there was an election. But as I say, the worklessness pilot, which is what I was involved in, definitely didn't end. The work continued. I know from the health and social care, which was mainly around joint commissioning, that joint commissioning work carried on, and we have the Section 75 board now and the works. And I think some of that actually went into what I believe is local government policy now. There's a lot of joint commissioning between health and social care. So that work kind of got absorbed into that, and less about the assets and energy. I don't know if how that progressed, but certainly the offender management stuff, I believe, has carried on, and the worklessness stuff never did end. So colleagues may remember, well, it's certainly in Lewisham, immediately after Total Place, we set up what was called the Family Budgets Program, which essentially implemented the recommendations of our Total Place pilot. And we worked with Job Centre Plus. We literally used to have families. Job Centre Plus gave us a budget. The Council on Job Centre Plus agreed a budget that we would give to the family. So instead of the family going on Job Centre Plus courses and whatever was available, they were able to choose the courses they want to. And if they weren't available for free, we could use that budget to pay. We use that budget to pay for whatever other support that they needed, because what we learned from the ethnographic work was that the real barriers to people seeking work wasn't, skills or they needed a new CV. It was basically things like mental health issues, physical issues, housing, childcare, blah, blah, blah. And so they used that budget to do things like pay for childcare for the first couple of months until they got a salary. They used it to kind of buy tools if they wanted to be, that's the kind of stuff that we did. So, and then following family budgets, we had what was called the Troubled Families Program. The government had a Troubled Families Program where you had, that thing. And so we used, again, our Total Place, the learning and the kind of methodology and the design of our Total Place worklessness pilot to shape our Troubled Families work. And so, we then sort of had caseworkers for each of these troubled families that we worked with to kind of, bring in the support. So no, it never really totally died in Lewisham. It carried on, but maybe not quite so, not quite in the same way. So yeah, and it carries on today. We have a family first approach where you have different professionals in family first children's centers. I think they're not quite children's centers, but they are family hubs, basically, i.e. children's centers in old speak, and so on and so forth. And we bring people together to work with individual families, acknowledging that families, we can't treat families in our silos. We have to come and meet them as a family. So yeah, it probably never really truly ended, although we did submit our kind of final reports to government.
And in Greater Manchester and Warrington, what happened next?
So we went from Total Place to community budgets to troubled families.
Yeah.
All of that became part of our public service reform. So we still do a lot of that. Learning is embedded in how we have embraced public service reform. And of course, it looks different in each local authority. So in Wigan, for instance, they have the deal, which is a way to change the relationship, and it's phenomenal. I've got all credit to them. I worked there for a while, but an example of how that worked was we had this program they still have this program for people with complex safeguarding issues, multiple complex safeguarding issues, and that aim was to get people into work, to be economically productive but happy and healthy. And we worked with one person who talked to us like this the whole time, and she couldn't get a job. And when we really built a relationship with her, she told us she had no teeth. And she didn't need back to work skills. She didn't need courses. She just needed teeth. She didn't have the confidence to work without teeth. So we organized false teeth for her, and she got a job about 3 weeks later. It's something as simple as that. And I suppose the biggest thing we learned is that we have a menu. Public sector has a menu, and we show it to people and say, pick off this menu. And actually, that's not the right approach. The right approach is to understand what people need and bend your menu to fit that. So in Stockport, I would say the journey of public service reform led to Stockport Family launching in 2016. Stockport Family is a fully integrated team of health, education and care, all working in the same teams, all working under a manager who might be one of those people. They might be education, they might be health, or they might be social care or early help. And they work together. The pandemic caused some blips in that because, of course, we're not in the office all the time now. And that's had to make us learn to manage our relationships better. Because the one thing that being integrated and sitting in the same office opposite each other helps is you don't do an email and wait 3 months to get a response. You just say, hey, what about so-and-so? Can we go and see them? But that integration is duplicated across Stockport. There's been some transformation money coming into Greater Manchester. I suppose one of my biggest frustrations, I'm going to say, about national government, and I can say this now because I'm retired and I'm not in a politically sensitive position anymore, is how they cut, and then they give you small pots of money back to do things. So they've massively cut services, and they gave around £500,000 average to local authorities to bring the domestic abuse bill in. They cut children's social care, and then they give you money for troubled families and community. But so you're always bidding for little pots of money and spending as much time justifying your spend. So we've got this part over here we can't use over here where it would be most useful. And the fact is that one of the things that Fenella said, which is really important, if you are an individual adult, the help for you out there, whether it's mental health, domestic abuse, drugs and alcohol, the help for you out there is nowhere near as comprehensive as it is for families. And that's why one of the public service reform changes we've made is how do we early intervene in an adult, because what the choice we're making when we talk about people with capacity and saying we don't have a service for them, which is what we say, the choice we're making is letting them get so bad. And I say it's a bit like a doctor saying to me, you're a bit overweight, Nuala, you are in line for a heart attack. So when you have one, come to me and I'll help you. We don't do that in health, but we do it in care. Well, you're a bit chaotic, but when you're really in crisis, come and talk to us. And that's some of the legacy of Total Places, that we're trying to not do that. I think some areas are further behind in adults, further ahead in children's, but we know we're much clearer about the need to be based on people's needs, understand people's needs, and not stick plasters on things. Not say, you've got domestic abuse, oh dear. The need to say, well, actually, we know you'll leave that relationship and go into another one and another one and another one. So how do we help you understand what a healthy relationship looks like?
I think sorry, Nuala, I think some of those frustrations you said earlier definitely resonate with people I've talked to. So thank you for saying them. Also, but what you said later has a real sort of note of hope about it, I think, and how we can do services a bit differently. And we can get even better than we are in the sort of isolated patches that we're good at doing them at the moment. So let's look forward to possibly another version of Total Place. What and this might, you may have meant, I'll go to you, Nuala, first, but you might have mentioned some government sets up another pilot for Total Place. Is that what it should do?
I think first it needs to understand the legacy, but in a better way. And I think, the things I've said, there's no cash to get out of the system. That is a holy grail. The only way to get cash out of the system is decommissioning services. And we've done that. I describe the cuts as we've got the early hanging fruit, we've got the branches, we've taken the trunk, and now we're trying to strip the roots down, and there ain't much left of that tree for us to go to. So imagining that you can do more for less is not right. We need to do less for less if we've got less, and be realistic about it. But what I would say is that but look at how we use our resources. There's still an awful lot of duplication in systems.
Yeah.
There's still a lot of work that can be done. So learn, take the time to learn from the legacy of Total Place, the legacy of community budgets, the legacy of troubled families, and the legacy of devolution and public service reform, which is, we've all got our story on that. And remember, it's the place and the people that count, and the people are the place, so work with people, and understand things like what co-production really is. Co-production is not saying, oh, I've got a great idea and it looks like this, I'll go out and ask people what they think of it. Co-production is saying, what are the problems you're experiencing, and how do we, the public sector, the community sector, the voluntary sector, and the people, see we could look to resolve those. That's co-production. Co-production is not consultation, and that's really important. And co-production is really, and remember, people are, we're in a really different place than 2008 and 2009. 2008 we had the crisis, but 2009 to some extent we were pulling out of it. Now we can't see an end to the pressures, the housing situation, the pressures on people's trying to survive. You can't rent a 2-bed flat in Stockport for less than £900, and yet our local housing allowance is £650. Where do people find the difference? They don't. So don't do lots of pilots, make sustainable change. That's my, don't say, oh, look, here's a great idea. We've done loads of pilots. We know the answers to lots of questions. So what's the sustainable change we can make? Where will investment make a difference?
Yeah. Fenella, so your thoughts on, looking forward to a potential second version of Total Place. What would you say?
So absolutely what Nuala said. I don't think we really need to waste time going back and doing pilots. I think it is absolutely about understanding the context of how we are now working, and which is obviously different from 2009. Customer expectations are different. Yes, we are all different now. I mean, try and tell some of my officers, my newer officers, that we actually used to come to work 5 days a week, and they kind of look at me in horror because they can't believe that sort of stuff happens. But the things that we were doing in 2009 relied on us being in, a lot of that was around the relationships and which you made because you were always in and out of each other's offices. We had offices down the road. A lot of public offices are now closing, and people are concentrating into different, more and more people desk sharing because councils are reducing councils and public partners are reducing their estate. So I think there might be a sort of, maybe not a new pilot, but a new kind of understanding of the 2024-25 context. I too was involved in, Nuala mentioned the Wigan pound. We had a Lewisham deal. The Wigan deal. We had a Lewisham deal as well. I was involved in that. We also in Lewisham set up a formal committee of the council, which was shared with the London Borough of Lambeth and the London Borough of Southwark on worklessness. I can't remember the section of the Local Government Act that we did, but we actually set up a formal body. So I think what I'm trying to say is that there is so much already in place around how, public agencies, and this was actually across 3 boroughs. So we brought our agencies across 3 boroughs together, it can be done. What government have to do going forward is they literally have to streamline regulation to lessen the burden on providers so that we can be more flexible. I think it's really important that KPIs, performance measures, the kind of stuff that goes with funding should be aligned so that all of us are working to similar outcomes. If you've given the NHS funding to deliver X and it's different from the funding I get to deliver Y, then it's clear that I'm going to struggle to deliver something that isn't Y because I have to deliver Y to continue my funding. So we need we need the government to give us a shared framework for our money so that we can, confidently go out and sort of design initiatives and everything that actually work for residents, because we're not going to be penalized afterwards with this, having to account for how we spent the money because we haven't spent it how government required us to do it. I do think we need to redesign service boundaries around customer need, genuinely around customer need. So, maybe getting rid of the local authority, the health authority, the this and the that, and we think about how public services should be organized around people who need this support, people who need that support, people need, and then, we all kind of, brave new world. But absolutely, I'm so glad I'm at the end of it, but it's a very brave new world. And very exciting.
Say, John, is be careful about saying that you're no longer working in silos.
Yes.
Because we worked in silos which were agency silos, and now we have a tendency to work in silos which are thematic silos.
Yeah.
So over here you've got the Domestic Abuse Partnership Board, which is working around domestic abuse, and over here you've got the Mental Health Partnership Board.
Yeah.
And actually, we absolutely know that domestic abuse, mental health, drug and housing, the wider predictors of health.
Yes.
So intertwined.
Really interesting point. That really interesting. And that's a whole other discussion, I think. And how successfully we can break the silo. Well, we don't want to break the silo mentality just to move to another set of silos, do we?
No.
We're going to have to draw it to a close here, and so thank you so much. I hope this has given everyone watching a new perspective and challenged your approach, or just given you something to think about. And I think some of the points I've taken is the importance of a shared vision, the importance of the commitment to place from everybody, building those relationships with senior leaders, sharing resources, if not budget, and also being realistic about what you can achieve. So it's not always about cashable savings because there's more demand in the system to meet. Looking forward, there is space, I think, for another Total Place, but you must learn the lessons from the last one, as we've talked about. So brilliant, and we've brilliant discussion, I think, and so advice and expertise here to make use of. So if you have any questions or thoughts following this, by all means, send me an email. We'll circulate a copy of the webinar for you to share with colleagues. And yeah, as I say, drop me a line if you want to talk further. Finally, just to say a really big thank you to Nuala and to Fenella for their expertise, their passion about all this stuff, and also for racking their brains back to 15 years ago and doing that very successfully. So thank you for joining us. Thank you to our panelists, and we'll see you again soon.
Okay.